Well, it's that time again, Medicare's annual election period. Every year, health insurance companies make changes to their current plans, and these changes can affect what you pay out of pocket for medications and those pesky co-payments.
Yes, and that's why it's recommended to reassess your plan, and right now is the time. Carolyn Dechaine, physician's assistant, she is with P3 Health Partners. She's here with some great advice on how to navigate all these choices.
Thank you.
Hi, welcome in.
Thank you.
Yeah, there's so many choices, and I know that folks face them every year, but sometimes it can be kind of daunting, and you want to make sure that you're making the right choices for you. Boy, I tell you, now through December 7th, huh?
Right, October 15 through December 7, you have lots of time to talk with a Medicare broker and figure out what plan is in your best interest. You might have medication changes or provider changes that you would like to switch to, so now is the time.
Well, let's take a step back. So for those who aren't familiar, who is eligible for Medicare, and really, what is Medicare all about?
So those who are eligible for Medicare are 65 and up, certain people with disabilities, and those with end-stage renal disease. Medicare is a United States federal health program offered to those folks.
Amazing.
Carolyn, let's talk about folks who are 65 or older. I know that, when you first enroll with Medicare, it must be like a pretty big event for a lot of people. And those choices are probably a little more daunting because they're looking at all the options for the first time.
Absolutely, they're overwhelmed. That's why I always tell people, if you need a Medicare agent to help you look through and understand the questions and how to answer things, you don't want to pick a wrong provider or a wrong clinic and not realize it till it's after the fact.
Yeah.
Right. Let's talk about those benefits. Of course, getting a Medicare Advantage plan, you get some cool things that come with it. So what are those benefits?
Oh, absolutely. But first, Medicare, just Part A. Medicare has two parts, Part A and Part B. Part A is pretty much hospital and hospice. And Part B is your providers, your specialty providers, mammograms, colonoscopies, bone densities, any MRIs. That's what you get with Part A and B with straight Medicare, traditional Medicare. But Medicare Advantage is exactly what that is. It is an Advantage plan. It bundles everything together, and you get the A and the B plus the D, which is the medications. So it offers a lot more for a less monthly cost.
Great.
Let me ask you too, do you have a lot of patients that are seniors?
I do
in your
indeed. I
practice?
have a lot. My oldest patient was 105 at one time. Yeah.
No
Wow.
kidding. So I know that folks must come to you with Medicare questions all the time.
Oh, absolutely.
Throughout the year.
I'm pretty well versed. We also have a Medicare agents. We have two that come to our office that are there at telephone, they will arrive either in the office or they're reachable by telephone. And so if we have questions, they immediately answer. They're very, very helpful.
Great. And when can these plans start, and when can people start experiencing these benefits? As early as hopefully the new year, right?
So you pick your plan between the October 15 and December 7, and it doesn't start until January 1st
Nice.
of the next year.
That makes it easy. There's a cutoff. So
Yeah.
Yes.
if people have questions, and I know there are a lot of folks watching who've kind of, maybe you've put off this decision a little bit, and maybe you're thinking right now you could use a little help. You had some recommendations for where people can get some assistance.
Absolutely, you can contact a Medicare broker, but it's very important to look into the Medicare Advantage plan because it offers a lot more prescriptions, gym memberships, vision, dental, hearing. You don't get any of that with the traditional Medicare. So if you really want more bang for your buck, you need to get the Medicare Advantage plan.
Definitely. And at the end of the day, it's important to just get a plan in general, right?
Correct.
Especially
Yes,
once
you
hit
want to
this
be
age.
covered.
Get covered.
Yes, have to
Yeah,
encourage
for sure.
people to take care of their health.
Absolutely.
Yeah.
Thank you so much for joining us.
Oh, you're welcome. Thank you for having me.
It's been fun
course.
to have you in this morning. Medicare Annual Enrollment, if you haven't heard us say it already, guys, it is now through December 7th. The website, p3nv.org. You can reach out. The phone number's also there on your screen.
And they're on social media too, on Facebook and Twitter, so give them a follow.